सैक्रम इज ए लार्ज ट्रैंगुलर फ्लैट बोन जो प्रेजेंट होती है स्पाइन के बेस पे। इसकी फॉर्मेशन होती है 5 सैक्रल वर्टिब्रे के फ्यूजन से जो S1 से लेकर S5 तक है। इट फॉर्म द पोस्टीरियर सुपीरियर पार्ट ऑफ द बोनी pelvis एंड it is present at the upper back part of the bony cavity. Due to the triangular shape of the sacrum bone, it is divided into two parts, that is base and the apex. The base part of the sacrum bone is uppermost broadest, which is tilted forward and the upward, which lead to the formation of an wing-like structure called ala. These ala on the either side articulate with the iliac portion of the hip bones with the help of an L-shaped sacroiliac joint. Apex is the lowest part, so it is narrow as compared to the upper part, that is base. And sacrum bone has three surfaces. First one is pelvic surface, which is concave and smooth. Second one is dorsal surface, which is irregular and convex. Third one is lateral surface, which is also irregular, and it is also of two types: left lateral surface and the right lateral surface. Sacrum bone also has a cavity called a sacral canal. Sacral canal is basically continuation of the vertebral canal, and it consists of an spinal meninges. The sacrum bone articulates with 4 bones. The first one is the last lumbar vertebrae above, the coccyx tailbone below, and the iliac portion of the hip bones on the either side. Variation in the sacrum bone in male and female. In case of male, the sacrum bone is longer and narrower as compared to the female, and in female the pelvic cavity is greater as compared to the male. Fracture of the sacrum bone is relatively uncommon condition, but if it occurs, then it is only occurred due to the neurological deficiency, but it is mostly treated with the help of the surgical fixation. Congenital disorder of sacrum. The first one is spine bifida and the another one is caudal regression syndrome. Cancer of sacrum. Sacrum is one of the most common site for the development of the sarcomas, which is also known as chordomas, and this chordomas is derived from the remnants of the embryonic notochord. Ossification of the sacrum is generally referred to the ossification of the 5 sacral vertebrae, and the upper 3 vertebrae has additional primary center, so there are total 21 primary center in the sacrum. The primary center of the sacrum appears between the 2nd and 8th week of fetal life, and it fuses with each other at the time of an 2nd and the 8th year of life. The secondary center of the ossification of the sacrum start to appear at the age of puberty, and it fuses by 25 years, and the individual sacral vertebrae are start to fusing with each other during the adulthood, and it fuses to form a one bone by 30 years. So this is all about my topic. Thank you.